Good afternoon, and thank you all for coming. In terms of full disclosure, I really appreciate your sharing this beautiful afternoon with us. If I wasn't speaking, I would be sitting on my back porch drinking a glass of wine and smoking a cigar right now. So I really do appreciate you all showing up. So it was about 12 years ago when I stumbled across focused ultrasound, which at that time was a embryonic or a nascent technology. And I had the premonition that this could be something really important, game-changing for therapy. And I got really excited about it and started to make the claim that was totally hyperbolic at the time, that focused ultrasound had the potential, and I emphasize potential, to be as revolutionary to therapy as MR scanning had been to diagnosis. At that time, that claim was supported only by words. It was a vision. It was not supported by any facts or evidence whatsoever. Now, things have changed in the last 10 years. The question has shifted from if focused ultrasound is something that could be used to improve the quality and longevity of life and decrease the cost of care for millions of people around the world with serious medical disorders, to when it's happening. And the field is literally exploding. In 10 years, the number of clinical indications, disorders, in various stages of research and development and commercialization has increased from 3 to more than 80. The number of mechanisms by which focused ultrasound interacts with tissue to exert its effect has increased from 3 to 18. The number of manufacturers creating these focused ultrasound devices has increased from 5 to 38. In 2014, 15,000 patients were treated around the world with focused ultrasound. 2015, it was 25,000. 2016, it was more than 50,000. The diffusion or adoption of a medical technology like focused ultrasound occurs exponentially, and we're right at the beginning of the inflection point of that curve. And the foundation's role is generally recognized as being the detonator for this explosion and being the catalyst that's kept the field growing. The foundation has been way more successful than anybody ever anticipated. And the success factors are, first of all, an extraordinary amount of luck. Secondly, perfect timing, which I guess is luck in a certain sense. But most importantly, it's people. And the reason the field's been so successful, the foundation's been so successful, is we have been able to amalgamate the donors to the foundation, the council, the board, and most importantly, the 24 or so full-time employees who get all the work done into an awesome force that's driving the field forward. And I'd like the team members to stand up and be recognized. And you've all heard me say that the foundation's been built, the team's been built with the philosophy that A's attract A's, and as a result of a very draconian, ongoing reconstructive pruning process, all the people who are still remaining here are A's. And it is, I have to say that it's been the greatest privilege and pleasure of my career to be associated with this group of people. And also in attendance, we have some of our board members and some of our council members and donors. And there are a couple of unsung heroes that need recognition. The first is Bill Crutchfield. Bill, where are you? Could you stand up? Okay, so the foundation wouldn't exist had it not been for Bill's inspiration and encouragement. In essence, it was his idea, but there's an interesting backstory that involves me, Bill, and the university administration. Secondly, Ted Weschler, in an unsolicited manner, provided an enormous amount of funding to get the foundation off the ground. He's not here, but he'll be here later. And then a couple of years after the foundation was started, Bill Howe was able to secure very significant funding for the foundation and the university for focused ultrasound research, which has contributed enormously to the success of the field. So just a few slides to tell you what we do. So we're all about improving the health and happiness of patients with serious medical disorders around the world. And we all know what Thomas Jefferson said, I'm no longer employed by the university, so I'm free to quote Thomas Jefferson without criticism from the faculty and the deans. Right, Rick? So what we do is we take our donors' money and invest it in a variety of activities that take advantage of opportunities and overcome barriers and shift the adoption curve to the left. Every day that we can shave off of the process that it takes for focused ultrasound to become a mainstream therapy translates into a reduction in death and disability and suffering for countless people, saving time, saving lives.
When I first heard I had Parkinson's, I was very surprised. I always thought of it being an older person's illness, and I've always seen people in wheelchairs, so I thought I was going to lose all my mobility. Basically anything that required movement, I couldn't do it. My leg would bounce uncontrollably. It would hyperextend and actually lock backwards. It was very, very painful. I couldn't walk, so I had to be taken in a wheelchair to the hospital. With each treatment, I could feel myself getting stronger and stronger. My symptoms were getting less and less, and my pain was getting less. Then the clinical trial director, she looked at me and she says, "Get up, you can walk." And I thought, I can walk. It was amazing. I got there in the wheelchair, unable to walk, and immediately following it, I walked to the room. It was a miracle. The focused ultrasound treatment has given me back my life. I've been able to go on walks. I've been able to run. Being able to ride my bike again. It's a miracle.
So in summary, what we do is invest our donors' philanthropic dollars into activities that create sound. And that sound results in miracles, which transforms disease into health and happiness for millions of people around the world. So the program is, we've brought 4 experts from around the world to talk about their research, their clinical research. And there are many, many new things going on. The theme here is what's new and what's on the horizon. And these individuals will share with you what they're doing in their respective fields, and then we'll have time for question and answer. And I emphasize that this is just a taste of what's going on in the field, a taste of what the most exciting things are. And we're starting off with Neal Lipsum, who's a neurosurgeon at Sunnybrook, the University of Toronto, Paige Gahuni, who's an interventional radiologist at Stanford, Franco Orsi from Milan, who's an interventional radiologist, and our hometown boy, Craig Slinghoff, who's a surgeon but is an authority on the treatment of malignant melanoma, but more importantly, he's one of the giants in the new field of cancer immuno-oncology. So let's get started with Neal.